everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about congenital clubfoot. So I hope you have watched the first part of this topic. And today we will be discussing about the diagnostic evaluation of congenital clubfoot. And then what is the management? So how do we manage clubfoot? Now, in the previous section, we have already discussed about the terms related to congenital clubfoot, and then what are the risk factors or causes of congenital clubfoot, and also we have seen the types of congenital clubfoot. So let us move to the diagnostic evaluation of congenital clubfoot. Well, the first one is history collection. Now, history collection plays a major role here. So, if either of the parents have congenital clubfoot, or if they have a child with congenital clubfoot, in that case, you might, get the hint that there is risk of the child getting congenital clubfoot. So even if it is before delivery or after delivery, the first thing would be history collection, and then we would do our physical examination. So in physical examination, we can find out the difference, the different manifestations that we have already learned. So in different types of congenital clubfoot, we can see different types of manifestations, such as several bones would be affected, right? So there are three major bones which would be affected, and in different types of congenital clubfoot, we can see that in some of the types, the talus bone would be affected. In some of the types, the calcaneus bone would be affected, and in some of the types, the navicular bone would be affected. So if while doing physical examination, we can find out these manifestations. And then ultrasound can be done during the pregnancy, so that can also tell us about if there is congenital clubfoot present in the fetus, and also we can do amniocentesis. So these are some of the diagnostic measures which can be helpful in diagnosing clubfoot. Next, let us move to the management of congenital clubfoot. Now, this condition cannot be managed, through pharmacological management. So here we won't discuss about any pharmacological management, because this condition requires serial manipulation and surgical management. Now, the first one is serial manipulation. So what we mean by serial manipulation? So basically here we would do several management to manipulate the deformity. So we have plaster cast or splinting. So this is a serial manipulation. And then there is Dennis Brown bar or splint. And then there is corrective shoe. So what this corrective shoe will do, this will basically help to hold the deformed part in a particular position. And that is how, we can manipulate the deformity. And then we also have Wheaton brace. So these are some of the examples of serial manipulation. Now next, let us move to the surgical management of congenital clubfoot. Now, surgical management is usually done at the age of 4 to 9 months. Now, surgery is usually performed at the age of 4 to 9 months, and after the surgical management, there is need of immobilization. So, it is basically done before the child begins to walk. So, in surgical management, tenotomy is done usually, and then after that there will be post-operative immobilization. So how they will do post-operative immobilization? Basically with the plaster cast for about 12 weeks. And then there will be usage of brace or corrective shoes for about 2 to 4 years. So this is the surgical management of congenital clubfoot. Now next, let us move to the nursing diagnosis of congenital clubfoot. And this risk is actually related to mechanical compression. And we also know that surgery has been performed in the lower extremity, so there might have been usage of traction, and then application of cast. So this would increase the risk for impaired skin integrity. So again, the second nursing diagnosis can be risk for impaired skin integrity. And then there will be acute pain, as there will be tissue damage, muscular damage due to the surgery. So because of that, the child will have pain. Next, let us move to the nurse's role, or we can say nursing intervention. So as a nurse, what are the things that we should do when we are taking care of a child with congenital clubfoot? So the first thing which is very important is obtaining a family history and the obstetric history. So this would indicate if there is any risk factors. And then after the delivery, you have to assess the ankle and the foot properly. If for the presence of true, talipus equinovarus. Now, sometimes there can be pseudo talipus. So to understand that, you have to assess the foot and the ankle properly. Well, for the infants who have already undergone the surgery, will have plaster cast applied on their lower extremities, right? So you have to assess the circulation, and if there is redness or swelling, if there is any abnormal odor, you can find out from distal to the plaster cast. So all these things you have to assess. And then you have to monitor the vital signs of the child, and specifically the temperature. So the children who have undergone tenotomy, they might get infection, and because of the infection they will have fever. So you have to continuously monitor their temperature. And you also have to evaluate the crying of the child, because you have to understand here for the infants, they cannot voice out their pain. So they might be crying because of the tingling sensation, because of the cast, or due to hunger, or due to wet diapers. So you have to understand, you have to evaluate the crying. Next thing, you should also remember that you have to keep the cast clean by changing the diapers frequently. So if you don't change it frequently, it might leak to the plaster cast, and it might damage the plaster cast. And you also have to remember, while wiping, you should not use soap and water, because that would cause breakdown of the plaster cast. And then you can also place a pillow or a padding under the casted plaster cast area, because this would prevent the damage of the plaster cast, as well as it would prevent sores from extreme pressure of the heel. For children who are having traction, for them you should continuously check the sites of pin, and you should clean the area. And once the final cast is removed, you have to explain the parents, you have to educate them that what is the importance of passive foot exercise. And you also have to educate the parents that maintaining the aligned position is very important to prevent reoccurrence. Also, this was all about nurse's role in taking care of a child with congenital clubfoot. So let us conclude our today's topic. So today we discussed about the diagnostic evaluations of congenital clubfoot, how it can be diagnosed, what are the different diagnostic approaches that we have, and then we have discussed about the management of congenital clubfoot. So I hope you have got a better insight about the topic. Thank you.